Biren Singh ji, I want to begin with you first and ask you on health as a subject matter of priority for you as a chief minister in your state. Because usually what is seen is that chief ministers and governments talk a lot about it, create the right noise, but in terms of budgetary allocation, we don't see a great deal being done.
You see, our priority is on education and health sector. During my first term in the last 2017 to 22 February, that you might have seen that what we launched and initiated for the welfare of, particularly in the health sector. Just we launched the Chief Minister ki Haksel ki Tangbang, means the health schemes for Chief Minister. Means we do provide rupees 2 lakh to each and every household under the below poverty line to get free medication, free treatment in the state hospital, including some of the outside hospital who is penalized. So, now already out of, 6 lakhs houses altogether in the state, we have distributed, provided the health card of 5 lakhs is to every, about to 4 household in the state. Means 60-70% of the total population has been covered. And above this, we also launched the Health for Old. Health for Old means our teams, including with doctors, nurses, Ashas, we are sending village to village. And we are taking up 10 diseases like breast cancer, BP, diabetes, etc., etc. Out of this 10 in category. And we do test there in their own home. And we provide medicine to them freely. Now, till today, we have already covered 2.5 lakhs people, house-to-house campaign, and around 600 villages has been covered now. And you see, in the most of the district hospitals, Manipur is a hilly terrain area, very difficulties area which could not reach through vehicles, motorable road is not there. But even then, we have established, e-technology, e-televised treatment through at various district headquarters. And in some 3, Chorchanpur, one this Tamenglong district, and Sandil district has been provided 24/7 power through solar power. Like this, we are doing our best in the health sector. I want to say, and I want to keep in front of you.
Mr. Biren Singh, this is Amitabh Bachchan. So we've just heard you and really appreciate some of the statistics that you have enumerated just now. I just have a very, not a personal question, but sort of very distinct. Whenever you announce these statistics, is there a methodology where you can actually monitor the kind of information that you have passed through the e-network to see that it is being implemented?
First of all, Bachchanji, namaste. So it's for being privileged to have discussed dialogues with you directly. Exactly under the leadership of the Honorable Prime Minister Narendra Modi ji, just digital facilities has been provided all over the state, except 5-10% left. Otherwise, 90-95% has been covered, sir. And just this data has been, I have my own one dashboard in my office, which is connecting directly to the district, all the district headquarters and the CMOs. So day-to-day development and the problems can be available in my office easily, sir.
No, I just asked this question because when we were doing the polio campaign, we didn't have the technology benefit with us.
Right.
And there were these workers who used to go into the deep forests and very difficult terrains personally, crossing rivers and forests and delivering these drugs and these dobuns in the Gike. And that was a personalized kind of information that we used to get. But now, as you rightly say, if you have some kind of technology that reports back to you, I was just wondering how authentic it is, because at the end of the day, it's not just the statistics, but to see how many people actually benefited from them.
Exactly. Just can you hear me?
Yes, we can. Yes.
Okay. This digital platform, which have expanded to the all over the state district headquarters, and we are monitoring through our head office also. Delhi, we are asking, and even just I just mentioned about the health for all. Health for all, we are sending our teams from village to village, and they're checking their health situation, entering inside their homes, and from that particular village also, we are able to receive the exact, if there is any serious patient, then by virtual, the patient can talk to the senior doctors who are staying in the Imphal hospital. That kind of facility also we provided. Yeah. So just we are feeling easy to deal in such a manner. Yeah. I would like to say.
My reason for asking this was because through the e-technology, you can monitor what has been delivered, but can you get a response from the person to whom it has been delivered? And that would be a very exact moment.
Yeah, very genuine question. Sometimes, monthly I do interact with even with the patient through the virtual. Just our doctors, our nurses will go directly to the patient, and the patient will be able to speak directly to me. Yeah. So they through virtual. That kind of facility also we are able to provide under the Honorable Prime Minister Narendra Modi's guidance.
That's very creditable. That's very creditable.
And we are also established one platform, CM the High C, giving a free telephone call, and they can complain anything to me in my name, CM the High C. Falana, we want this, we want it. Then my team will automatically respond. And if there is any seriousness, then my team will directly bring me the call, and I will talk to them.
Wonderful.
That is
well done.
Very much. Okay.
Sir, this is Pranoy Roy, sir. Thank you very much for joining us. It's a great honor. So as you know, we are focusing on two big things here. One is health of children and general health care in our society. And we just want to ask you to say yes to two things, which we're going to ask all chief ministers, but Manipur can lead the way if you say yes. One, please commit to increasing the budget expenditure on child health care by just 15% every year. A year, 15%, which means in 5 years you'll have doubled it, which is a big step, and you'll lead the way in India. And secondly, will you increase the number of Asha workers from whatever it is in 5 years to 5 times what it is now, and give them a slight increase in their, or not a slight, an increase in their income. These two commitments, if you can make, you will lead India. We're going to get all chief ministers to commit to this much: child health care and Asha workers.
Rohiji, very, very thanks for talking directly in a meeting with you.
Thank you, sir.
Why not? Why not? We are giving priority to the children. Children is our futures. And just we are having, the shortage of revenue as a small state, even though just we are encouraging, we are prioritizing in the health and education, and surely we will increase that kind of
Thank you, sir.
budget also.
That's
And,
great to hear. Great to hear that. Thank you very, very much. Thank you.
Yeah.
Thank you.
And the second question is about Asha.
Asha workers. Yeah.
You rightly mentioned Asha, they are not getting much payment, only 1,000. Earlier it was, their honorarium was hardly 500 only.
Yeah.
But now we have increased to 1,000. And their working style is so, commendable, sir. Commendable.
Really?
Just during the COVID, they're never afraid and they doesn't care of anything. And they do go wherever the patient is there. Wherever the government asks, they will go. They sacrifice. And definitely the government has already we have increased their remuneration. And again, I assure you, they are the only people who are working in the fields. We have to encourage them. You are rightly pointed out.
Thank you, sir. Thank you. You will lead the way in this. Thank you.
Thank you. Thank you very much.
Thank you so much, sir. Thank you.
Thank you so much, Mr. N. Biren Singh.